Hey, I've been wondering about something lately. Can you pay to see a doctor in Quebec?
Ah, that's an interesting question. The healthcare system in Quebec is a bit different from what you might be used to in some other places. In general, Quebec has a universal healthcare system, which means that most medical services are covered by the provincial government.
So, does that mean you can't pay to see a doctor if you want to?
Well, yes and no. Under the Quebec Health Insurance Plan, RAMC, most basic medical services are covered, and you don't have to pay out of pocket when you see a family doctor or a specialist who is part of the public health care system.
That sounds pretty comprehensive. But what if I want to see a doctor outside of the public system or get faster access to a specialist?
In that case, you do have options. Quebec allows for private health care services, which means you can pay to see a doctor or specialist if you prefer or need quicker access. However, it's worth noting that this can be quite expensive and is generally not covered by the public health insurance plan.
So, private health care is an option, but it can be costly. What are the pros and cons of this system?
The main advantage is that it can provide faster access to medical services, including elective surgeries and specialist consultations. This can be beneficial for those who don't want to wait for the sometimes lengthy public system queues. However, the downside is that it can be expensive and may not be accessible to everyone. It also raises questions about equity in health care.
I see, so it's a trade-off between quicker access and cost. But what about emergency care? Is that covered for everyone in Quebec?
Emergency care is universally covered in Quebec. If you have a medical emergency, you can go to the nearest hospital, and you won't have to worry about the cost. This is a fundamental aspect of the province's health care system to ensure that everyone receives essential medical attention when they need it.
That's reassuring to know. It sounds like Quebec's health care system is a mix of public and private options, with a strong emphasis on universal coverage for essential services.
Exactly. It's designed to ensure that everyone has access to necessary medical care, but there are also options for those who are willing and able to pay for private services. It's a system that aims to balance accessibility and choice.
Thanks for explaining that. It's always good to have a clear understanding of how healthcare works in different places.
You're welcome. Healthcare systems can be complex, but it's important to know how they function to make informed decisions about our health and well-being.